Yeah, our group is mostly concerned about trying to elucidate whether the cannabinoid system can control the proliferation, differentiation, and survival of cells in our body, either pathologically, as in cancer, or physiologically, as for instance during brain development in the embryo. So in cancer, we are trying to find out whether the endogenous cannabinoid system is a tumor suppressive system. It's a system that protects our cells from getting transformed, and those transformed cells from proliferating and surviving. So far, our data support that at least pharmacological activation of cannabinoid receptors can decrease the growth of tumor cells in different models of cancer in mice and rats. Still, we don't know what would happen in humans. And we are also dealing with the endogenous system, as I said, and we are trying to demonstrate that, in fact, the endogenous system is a brake for tumor growth in our body. Yeah, cannabis is a complex plant. It has many different compounds, about 100 different cannabinoids and about 400 other compounds. So when we talk about cannabis, is always, I think, precise to define which are the most relevant cannabinoids in that complex preparation, so that those compounds are the compounds that are responsible for the effects. We are mostly dealing with two cannabinoids. One is THC, tetrahydrocannabinol, which is the most important bioactive compound in cannabis, and the other one is cannabidiol, which is very strongly potent towards cannabinoid receptors, but it has other targets still unknown, which can also influence tumor cell growth and survival. So we work with cannabis extracts because at the end there are many patients that use whole cannabis or cannabis-derived preparations, and also the main medicine, cannabinoid-based medicine that is approved nowadays in Europe is Sativex, that has not only THC and CBD, but also other compounds. But usually to standardize the doses and the time courses and that kind of factors, pharmacological factors, it's recommendable to use pure compounds. So we mostly work with THC and or CBD in different combinations, and also with extracts which are enriched in THC and CBD. We are mostly focused in two different types of cancer. One is brain cancer, brain tumors, malignant brain tumors, and the other one is breast cancer. We have done some work in other types of cancer, but nowadays we are mostly focused on that, and in both types of cancer we have seen that both THC and CBD alone or in different combinations, and not only themselves, but when combined to classical chemotherapeutic drugs, they have a strong anti-tumor effect in animal models of cancer, of those two types of cancer. Sure. Yeah, there is a possible relation, as all the things is not very robustly demonstrated, between the intake of cannabinoids from the plant, for instance, and the levels of endogenous cannabinoids. In general, as it happens with other similar situations, for instance, when a drug is taken that mimics the action of an endogenous system, usually that endogenous system is downregulated when the drug is taken from outside to do the same job, to bind the same receptors. So usually what we find is that when an animal is given THC, for instance, the levels of anandamide and 2-arachimonoglycerol, the two endocannabinoids, decrease. That is not a rule, because there are other instances in which it happens the opposite. That is maybe due to the fact that cannabinoid receptors are downregulated very strongly by THC, especially in some areas of the brain. So in those situations, what usually happens is that the intake of THC, by downregulating the receptors, increase the generation of anandamide 2-AG as a kind of compensatory action. But in general, there is an opposite effect between cannabinoids and endocannabinoids. I mean, when we take in cannabinoids, endocannabinoids tend to go down. Well, I think I would divide the possible therapeutic applications of cannabinoids and/or modulators of the endocannabinoid system in cancer into major types of actions. One are the palliative actions, and the second one would be the possibly curative actions, or at least actions towards the origin, the etiology of the disease. Regarding palliation, there are some of the effects of cannabis that are more or less proved, and they are in fact used in the clinics, although not very widely. One is, for instance, the attenuation of nausea and vomiting upon the intake of chemotherapeutic drugs. Another one is pain. Cannabinoids are painkillers, and they work relatively well in some cancer patients. There may be other actions of cannabinoids that can palliate some symptoms of cancer, for instance, anxiety, depression, etc., stress, insomnia, but they are not so well demonstrated, or they are not so widely applied to the cancer patient populations. So overall, I would have to highlight two of the palliative actions of cannabinoids. There is the antiemetic action and the pain-killing action, the analgesic action. That is one part of the story, and the other one would be the possible action of cannabinoids to decrease tumor growth. In that respect, we are still a bit or quite at a loss in humans. I mean, we don't know what would happen in humans. Of course, you know, there are many drugs that are tested in mice and in rats that work very well towards cancer, but then when they are taken to clinical trials, they fail, and most of the time because of high toxicity or very little bioavailability or high toxicity, etc. So low tolerability at the end. We don't know what will happen with cannabinoids. We conducted a pilot clinical trial some 6 years ago with a reduced number of glioblastoma patients, specifically 9 patients, and we found that the administration of THC was safe, it was well tolerated by the patients, and although it was a very small population, we found some responses in terms of biomarkers and in terms of magnetic resonance imaging to monitor the size of the tumor in some of the patients. That was, as I said, a very small pilot trial, so we cannot infer any statistically robust conclusion, but it seems that in some of the patients there were some effects. Now we are dealing with combinations of cannabinoids, THC and CBD. In that former trial, it was only THC that was given to the patients, and now we are testing whether combinations of THC and CBD together with classical chemotherapeutic drugs can exert significant effects in animal models. And we have found that, for instance, in the case of glioblastoma, the benchmark drug, that is the first line drug that is used for that type of cancer, that is temozolomide, that is an alkylating agent. When combined with cannabinoids, specifically with mixtures of THC and CBD, it has a very synergic action. So that is what we would like to test in the clinics in the next years. Try to give the patients a cannabinoid-based medicine that is composed of THC plus CBD together with temozolomide to see whether the cannabinoids can enhance the anti-tumor action of temozolomide.
Thank you very much.
Thank you. Thanks so much. Thanks so much indeed.
If everything's ready here on the dark side of the moon, play the 5 tones.